What would you do if you suddenly felt numbness in your face while alone at home? Would you recognize what was happening? Would you know how to respond fast if you were having a stroke and there was no one around to help? The truth is, a stroke can strike without warning at any time and in any place. It doesn't wait until you're with family or in a hospital. It can happen while you're working, walking, cooking, driving, or simply sitting alone at home. Every year, over 795,000 people in the US have a stroke. That's one every 40 seconds. And in those critical first minutes, the decisions you make can mean the difference between recovery and lifelong disability, or even death. Yet most stroke survival advice assumes one crucial thing: that someone else will be there to call 911, unlock the door, or notice your symptoms. But what if you're one of the millions who live alone? Would you survive a stroke if no one was there to help you? In this video, we'll walk you through 5 life-saving actions that could drastically increase your chances of survival when you're experiencing a stroke alone. You'll learn the early warning signs of a stroke, including the subtle symptoms most people miss, why your smartphone or smart speaker may be your best emergency tool, the counterintuitive body position that might just save your life while you wait for help, a simple documentation trick emergency doctors wish more patients used, and how something as basic as unlocking your door could save precious minutes when EMTs arrive, why every second matters. A stroke happens when blood flow to part of your brain is blocked or reduced. Within minutes, brain cells begin to die permanently. That's why time is brain. The faster you recognize what's happening and get treatment, the greater your chances of surviving and recovering. But when you're alone, you don't have time to second-guess your symptoms or wait to see if it passes. You have to act immediately. Why this matters more than ever. Today, more people are living alone than at any other point in history, especially adults over 60 who are at higher risk of stroke. That means more individuals than ever before may be completely alone when they experience their first stroke. And the harsh truth? Most people don't know what to do in those first few minutes, and many don't survive because of it. But you can be prepared. Knowing how to act calmly and quickly could save your brain and your life. So stay with us as we walk you through each of the 5 essential steps. These could mean the difference between calling for help or never getting the chance. Have you ever had a stroke while alone? If so, what did you do? What helped and what didn't? Your experience could help others be better prepared. Share your story in the comments below. Now let's go over 5 critical actions you can take to protect yourself when a stroke strikes and no one is around. 1. Recognize the symptoms immediately. The first and most important step in surviving a stroke alone is recognizing that you're having one. Sounds simple, right? But it's not. Strokes can impair judgment and cause confusion. Your brain may try to downplay or explain away the symptoms, delaying crucial action. That's why it's vital to know and use the FAST test, a simple acronym that helps detect the most common signs of stroke. F. Face. Look in the mirror or use your phone's front camera. Try to smile. Does one side of your face droop or feel numb? And arms. Raise both arms in front of you. Does one arm drift downward or feel weaker than the other? S. Speech. Say a sentence out loud, something simple like, "The sky is blue today." Is your speech slurred, slow, or hard to understand? T. Time. If you notice any of these signs, don't wait. Call emergency services immediately. Every minute matters. Other warning signs to watch for. Not every stroke fits the classic FAST pattern. Here are additional red flags to watch out for, especially if they come on suddenly. Numbness or weakness in the leg, arm or face, particularly on one side. Sudden confusion or trouble speaking or understanding others. Blurred or double vision in one or both eyes. Trouble walking, dizziness, loss of balance, or coordination. A sudden severe headache with no known cause, important. If you notice any of these symptoms, even if they seem mild or come and go, don't assume it will pass. Stroke symptoms rarely resolve without medical treatment, and delaying action increases brain damage. 2. Call emergency services immediately. Once you recognize stroke symptoms, your absolute priority is getting medical help as fast as possible. A stroke is a race against time. The longer the brain is deprived of oxygen, the more damage occurs. Even a few minutes can make a huge difference. But here's the challenge. If you're slurring, confused, or partially paralyzed, making that call can feel overwhelming. That's why it's important to know what to say and what tools can help. Can't speak clearly? Try this. Say the word stroke if you can. And stay on the line. Emergency dispatchers are trained to recognize speech difficulty and other signs of stroke. Down. If you're using a smartphone, activate a voice assistant. Hey Siri, call 911. OK Google, emergency call, alternate emergency tools. Use emergency buttons on your phone, e.g. press the power button 5 times quickly. Activate a smart speaker. Alexa, call for help. If you're in an apartment, bang on the walls or floors to alert neighbors. Use medical alert devices or wearables if you have them. When connected to dispatch, say, I think I'm having a stroke. Your full address or the most precise location possible. Let them know if your door is locked. Emergency responders may need to break in. Request a stroke center, if possible. Ask to be taken to a designated stroke center. Hospitals equipped with specialized teams and technology for rapid stroke treatment. Pro tip. Some emergency systems can bypass the nearest hospital to get you to a better equipped stroke facility if requested and available. 3. Make yourself accessible to help. After calling 911, unlock your door. If you can safely move, go closer to your front door or main entrance. Make your location easier to find. Turn on outside lights, open blinds or curtains. Make noise if you're in a hard-to-see area. If you're able, gather a list of your medications, your medical history, emergency contacts, doctor's name. Clear pathways for responders. Turn off dangerous appliances like the stove. If you have pets, secure them to prevent interference with emergency responders. 4. Position yourself safely. While waiting, once you've called for help and made your location accessible, the next step is to protect yourself while you wait for emergency responders. Stroke symptoms like dizziness, muscle weakness or confusion can increase your risk of falling, choking or worsening your condition, so your positioning matters more than you might think. Lie down to prevent falls if you're feeling lightheaded, unsteady or weak. Lie down on your side in a safe, open space away from furniture or sharp edges. This reduces your risk of falling or injuring yourself further. Use the recovery position to stay safe and maintain an open airway. Adopt the recovery position. Lie on your side, not on your back or stomach. Bend your top leg slightly forward to prevent rolling. Use your bottom arm to support your head or place a small pillow under your head. Slightly elevate your head if possible. This can help reduce pressure inside the skull during certain types of strokes. Avoid food or drink. Do not eat or drink anything while waiting for help. Strokes can impair swallowing reflexes, making choking a serious risk. Also, certain stroke treatments can't be safely administered if you've recently eaten. Loosen restrictive clothing. Remove or loosen tight collars, belts or waistbands to improve circulation and breathing. Adjust room temperature if needed. Stay warm, but avoid overheating, as strokes can affect the body's ability to regulate temperature. Stay calm and breathe. This may be difficult, but panic increases blood pressure, which can worsen stroke damage. Try to breathe slowly and steadily. Focus on staying as relaxed as possible. Remind yourself, help is on the way, and you've already taken the most important steps. These small actions can reduce complications and give you the best chance of stabilizing your condition until medical care arrives. 5. Document your symptoms and their progression if you're conscious. Track the time symptoms started. This is critical for treatment. Use your phone too. Note when symptoms began. Record which symptoms you feel. Log changes or worsening. Use voice memos if typing is hard. Also record medications you've taken. Any actions you've taken since symptoms started. Set an alarm to go off every few minutes as a check-in in case you lose consciousness. What happens after help arrives? Once at the hospital, doctors work to restore blood flow, often using clot-dissolving drugs like TPA, mechanical clot removal. These only work if given quickly. Time is brain. Recovery includes physical therapy, speech therapy, occupational therapy. With time and support, many stroke survivors recover significant function thanks to the brain's adaptability. The best way to survive a stroke. Prevent 1. Manage your risk factors: high blood pressure, high cholesterol, diabetes, smoking, excessive alcohol. See your doctor regularly. If you live alone, consider medical alert systems, smart home devices, regular check-ins with loved ones. Time is everything. Be prepared. Knowing how to respond when you're alone could save your brain and your life. A stroke can happen to anyone at any time. But knowing how to act quickly and confidently, especially when you're alone, can mean the difference between full recovery and permanent damage. You've now learned the 5 critical steps that could save your life in those first few minutes. Now it's your turn. Were you already familiar with these stroke survival steps? Do you have personal tips, experiences, or questions to share? Leave a comment below. Your insight could help someone else be better prepared. Thanks for watching, and stay safe, stay informed.